Good evening, doctors. Welcome again. Today we are going to discuss about myasthenia gravis. Definition is an autoimmune disorder. Here is antibodies block acetylcholine receptors, motor end plate, postsynaptic acetylcholine receptor. When muscle secretes acetylcholine, this acetylcholine release and it acts on MED, that is motor end plate. But here antibody is present, so acetylcholine blocks. So no muscle contraction occur and patient feel weakness. In female, this myasthenia gravis present at the age of 20 to 30 years. In male, it is 60 to 70 years. Clinical features includes evening fatigue, exhausted, wherein polymyositis and dermatomyositis, morning fatigue and weakness or pain in muscle, fluctuating muscle weakness. Ptosis most common symptom. Proximal muscles involved more than distal muscles. It involves 3, 4, 6, 9, 10 and 12th cranial nerve. Due to involvement of 3, 4 and 6 cranial nerve occurs diplopia and visual difficulties where 9, 10th and 12th involvement cranial nerve causes dysphagia, mastication difficulty, not able to finish meal. Okay. Some another symptoms like shortness of breath, muscles of diaphragm involved due to involvement of muscles of diaphragm, shortness of breath, nasal speech, this is known as mushy, snarling face appearance due to muscle involvement, sensation reflexes or pupillary accommodation reflex, normal intact we can say. Antibodies, how to diagnose? We ordered antibodies, acetylcholine receptor antibodies found in thymus 80 to 90%. Anti-musk antibodies, this is muscle specific kinase. Anti-muscarinic antibodies also present. Drugs contraindicated in myasthenia patient, that is aminoglycosides. Example amikacin, gentamicin. Quinolones like fluoroquinolones, levoflox and moxifloxacin. Beta blockers, bisoprolol, etc. Metoprolol, quinine and class 1A antiarrhythmic drugs contraindicated. Non-depolarizing muscle relaxant also contraindicated with this. Okay. How to investigate this myasthenia gravis? Ordered acetylcholine receptor antibodies 80 to 90%. Anti-muscarinic or anti-musk antibodies. Most confirmatory test is by EMG, electromyography, mass myography. Hydrophonium test is a screening test for some cases, not for all. Repeated nerve stimulation, we see decremental response. Repeated nerve stimulation, we see nerve responses decreases. But in case of acute crisis, we need treatment is by plasmapheresis or IV immunoglobulin G. In chronic, first drug of choice is anticholinesterase like neostigmine and pyridoxigmine. We use pyridoxigmine because this is long acting. Thymectomy, 10 to 20% thymomas are cause of myasthenia. 70% is thymic hyperplasia, so thymectomy. With or without thymoma or thymic hyperplasia, if conservative treatment is failed, then we need to do thymectomy. Thymectomy is contraindicated in ocular myasthenia or child more than 60 years of age. Okay. Or a patient more than 60 years, is not child 60 years above. If thymectomy done, no improvement, then immunosuppression. Best is corticosteroids like prednisolone, and after some time we can use azathioprine, which reduces function of T cells. And nowadays we can use mycophenolate, that is less toxic than azathioprine. So guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me, and if you're new on my channel, please subscribe it. Thank you, good day, goodbye. That's all for